Okay, so welcome back, everyone, and very excited to start this next session, which is a panel discussion with a group of individuals that are well established, well known in the HIV research community for many years. And in past years in our workshops, we've done roundtable events where participants in small groups of 3 to 5 would sit down and have a one-on-one discussion with the panelists. We had to get creative with this web-based session. So Keith and I are going to direct some of the Q&A. Really important for the participants to enter your thoughts in the discussion form. And if you have specific questions, please put those in the Q&A box. Okay, so it looks like almost everybody is back. So we're going to start off with a quick introduction. So we'll start with Dr. Marissa Becker from the University of Manitoba. You take it away. Everybody will introduce ourselves, and then we'll get into the big discussion.
Thanks, Curtis. Sorry, looking for that forever mute and unmute button. Hi, everyone. Good afternoon to everyone. It's great to be here. Thanks to Curtis and Keith for the opportunity and Carr for having us. My name is Marissa Becker. I'm an associate professor in the Institute for Global Public Health in the Departments of Community Health Sciences and Medical Microbiology and Infectious Diseases at the University of Manitoba. And I'm an adult infectious disease physician, although my clinical work these days is largely focused on HIV medicine, and I'm a proud CAR board member.
Great, thanks. And what Marissa didn't mention is she's calling all the way from India. So thank you for taking time out of your late evening to join us. Let's go with Dr. Alexandra King from University of Saskatchewan.
Hello, everybody. Alexandra King. I am a member of Nipissing First Nation, which is in Ontario, and as such belong to both Eagle Clan as well as Turtle Clan. I work at the University of Saskatchewan as the Chemi Co-Chair in Indigenous Health and Wellness with an academic appointment in the Department of Medicine. I practice as an internist, but really focus my practice on HIV and hepatitis C, and spend much of my time doing research. And so I just want to say hello. Curtis mentioned that he was on with a bunch of friends, and I certainly feel the same way. And also just want to mention that I'm speaking to you from Treaty 6 territory, homeland of the Métis, in a place that's become known as Saskatoon.
Great, thanks. Okay, let's go next with Dr. Shirou Karashek.
Thanks, Curtis, and good morning, good afternoon. I don't think it's evening anywhere yet, so good to virtually see and hear you all. And thanks to Carr for organizing this virtually. So my name is Shirou Karashek, and I wear a couple of hats. I am here, I see from the list today, as a representative from CIHR. So I, in my current role, work as CIHR Institute of Infection and Immunity Scientific Director. And in that capacity, I am responsible for shaping a lot of funding opportunities that many of you might be familiar with in the area of HIV, STBBIs, but also in the general area of infection and immunity, so microbiome, inflammation, hepatitis. So a lot of those opportunities that are strategic investments are shaped by the Institute of Infection and Immunity. My other hat is of being at McMaster as an HIV researcher. So I have an active lab, and I know many of you, and certainly the colleagues who are here today, from my 20 years of working in HIV researcher as a mucosal immunologist, with my research focused primarily on women's reproductive health. So looking at the susceptibility and immune responses to HIV and other sexually transmitted viruses in the female reproductive tract. So happy to be here and happy to have this chat.
Great, good to see you again. Let's next move to Terry Howard.
Hello, everyone. It's Terry Howard here, and I'm a community researcher from the Vancouver area. And I'm a trainer and actually a researcher myself in Vancouver in HIV, and have been since 2008. Also a former board member, both as a community rep and as a secretary for the board at CAR. And a variety of other things. Currently, I'm doing prison outreach and education in prison, but mostly what I am responsible for is doing education with community members and skills building. Thanks, Curtis.
Great,
Curtis.
good to see you again. Great, good to see you again, Terry. Keith, why don't you just quickly remind the crowd who you are and what you do?
Sure. I'm Keith Folk at the University of Manitoba, Department of Medical Microbiology. I'm a cellular immunologist, so I study how HIV interacts with the cells of the immune system, and how it disrupts the immune system, and how we can try to prevent HIV infections by modulating the immune system. And I do studies that are both based in Winnipeg, working with local communities, homeless communities in Winnipeg, but also with groups in Nairobi, Kenya, female sex workers that we've been privileged to work with in partnership for a number of years. So that's where I'm coming from. And Curtis, who are you and what do you do?
Yes, well, I am an infectious disease specialist, an adult infectious disease specialist at the Ottawa Hospital. I'm a clinician scientist with the Ottawa Hospital Research Institute and University of Ottawa. And I spent a lot of my last 20 years involved with developing the direct acting antivirals for hepatitis C treatment, which we currently use. And in that 20 years, we went from having horrible therapies that weren't really accessible to most people to treatments that are now safe, well tolerated, can be used by almost anybody, irrespective of what barriers they may be facing, and the cure rates are fantastic. Also, am very involved with cohort research, so a number of regional, provincial, and national cohorts that I'm a scientist with, and using this data to from an epidemiologic point of view. So I'm a clinician researcher and I'm a physician, and I sort of bring that perspective to our group. So thanks to everybody for that. Now, the name of this session is Exploring Career Paths and Avenues to Success. And we've all been there. We were all young, keen researchers, all sort of trying to decide where do we embark. And sometimes the problem is not having a good contact that you can pick the brain of. So here we are. You've heard what we do, and let's get going. What do you say we start with Marissa? What would you say to any individuals that want to get into a career in global health?
Thanks, Curtis. So first, I'd say go for it. If it's what you want to do, absolutely go for it. So I can share a little bit of where I ended up, or where I'm at for now, anyways, if that would be helpful. So as Curtis noted, I'm speaking to you from Delhi, India, where I'm based as a part of my role for the Institute for Global Public Health. And I think that my journey's been a pretty meandering one, I think serendipitous. So my research is focused on HIV prevention and care, and I use a program science approach for my work. And so my program of research involves work in Manitoba, India, Kenya, and Ukraine, and is aimed at strengthening our understanding of HIV and other infectious disease risk, vulnerability, and outcomes among more vulnerable populations, and particularly have a specific focus on adolescent girls, young women, and female sex workers. And the goal of my research is to really help to build evidence to strengthen or optimize prevention programs. And by using a program science approach, my research is most typically embedded within programs to help answer or address really key or priority program issues or challenges. So I think that within global health, you can approach it from so many different perspectives or lenses or pathways. And Keith shared some of the work that he does in global health. And I've just sort of briefly highlighted a couple of the areas that I focus on within global health. But it's an amazing opportunity in which to work, and I feel really lucky to be able to be a part of it. It can be a circuitous journey, but I think that if you've got that interest and the passion for it, then I would highly encourage you to further explore it. And Curtis, if you want, I can talk a bit more about sort of how I ended up doing it, but I'll pass it back to you and you let me know where you want to go.
Sure. Well, again, this is sort of a organic, free-flowing session. I do ask the participants to put in your questions and answers, and we will try to get to those as well. And after all, this session is for you to ask any big questions that you'd like to hear from our panel. Shirou, why don't you you go next? Oh, you're on mute.
Yeah, just moving the two screens around so I can find the unmute button. So yeah, so happy to do that. So, you know, like Marissa, and I think that's true for majority of people, that unless you are identified as a protege or a star early in your career, you know, most of us kind of meander through our way of, you know, what are we doing now? What are we doing 5 years from now? You know, where your journey takes you, you know, at the end of 10 and 15 years. So, you know, that's probably a theme that you're going to hear from many of us, that, you know, it's not sort of a straight line vertically to where you look. And I frequently, when I give these kind of talks, I equate it to the sort of the surface of the iceberg, the part that you can see that all of us look very successful. You know, we're very mature, we have successful careers for all intents and purposes, but the 20, 25 years of work that has gone on behind that, where we were exactly where many of you are, you know, trying to figure your way, get your first grant, get your lab established, balance having kids with, you know, trying to get a successful lab. Those are all of our stories. So mine is no different. You know, I did my PhD in India, where Marissa is in New Delhi at the National Institute of Immunology, did my postdoc in US at Dartmouth Medical School. You know, found my way to Canada. McMaster's was at that time, you know, in late 1990s, sort of the mecca of mucosal immunology. I was super excited to join the group here. They were looking for somebody to bring in that mucosal immunology aspect, you know, in vaccinations to sexually transmitted infections, you know, so again, balancing career with having kids and establishing a lab, very challenging time of probably for most people who are trying to do that all. And the reality is you cannot do it all. So you have to find that balance where you can find your piece. So that's one piece of advice that, you know, I tell everybody, that what's your right balance? You need to figure that out for you. And then, you know, you coast along, make your way through the academic career. You know, if you're lucky, you get grants in a steady pace. If you're not, then you're dealing with, you know, where's my next amount of funding coming from. I think I was one of the lucky few who, after my initial break, was able to get steady funding. And expand research, you know, be able to get more students, more work. I've worked with many colleagues here in partnerships One of the probably biggest things that I want to flag for people is to, keep an open mind to the opportunities that come your way. So I was an OHT and scholar at one point, and through that agency, I had the opportunity to work with community, the African Caribbean community, because I was working with women's reproductive health. And that probably changed my perspective from research, from being a very academic pillar one biomedical researcher to understanding that research is really relevant to the people who will be affected by it. So probably for the last 15 years, a big perspective for me has been to do the research that actually makes a difference to people in real life. And that has been really sort of the motivation of what I do now, because that was sort of my first foray into working policies and doing work that changes people's lives or helps people. And then eventually keeping your mind open and finding an opportunity like the one that I'm in now, where it's really about science policy and seeing what is the need for the research community and what can an agency, a national funding agency like CIHR do to invest funding in the right areas that can benefit, researchers in my community, which is the infection and immunity community. So I've been doing this role almost for 3 years now, 2 of which were in the pandemic, which was not something that I had planned for, but here I am, and doing the best that we can to keep our head above the water, and hopefully doing a good job of it. So I'll stop there, and again, happy to answer any specific questions, Curtis.
Sure, no, that's great. And I mean, it's, I think you articulated a career path that many of us aspire to. Is, when we're just brand new faculty, the focus really is on your own work. That first 5 years of your first appointment is critical, or your job, or wherever you end up in your career. You got to make hay, and so you need protected time. You need to be surrounded by people who are looking out for you, and that are not saddling you with stuff that is going to impede your ability to get the papers out, to get the grants that you need. But as you progress, you want to start making a difference for other people. So surrounding yourselves with young, eager trainees, and then to get yourself to a point that many people on this panel are in, where they can start making and helping to contribute to the big decisions that will determine where research is going, ensuring that there's opportunities for every young trainee to flourish if they're interested and hardworking and keen to do that. Keith, you're also in a position now to sort of help to make policy and direct research that's relevant to people living in Canada, and also that's something that all people can contribute and participate in. What are your thoughts about that?
Yeah, thanks. I think that the reason that we do research is because we want to improve the world around us. Some people are really talented in that they can paint and they add beauty to the world in different kinds of ways. Some people sing, some people are very artistic. I'm none of those. The way that I try to improve the world is, first of all, I try to train trainees who are going to go off and do great and wonderful things much better than I. I'm also blessed to be a father, and so I think my children will improve the world and do great things. But I think that as a researcher, our primary driving interest is how do we improve the world, and I think that that can happen at a number of different levels. It can happen as a trainee working on a project, and it can happen as an administrator trying to make the environment better for people to conduct their research and to change the world. We just look at the COVID vaccines right now. I mean, that's all research driven. In the HIV field, we've been trying to develop a vaccine for 25, 30 years now. And we haven't had a lot of success because HIV is a very different kind of virus. But we're trying and we're making progress. And all of that sort of failed effort in the HIV field, I think has set the stage, has built a scientific foundation for being able to develop a COVID vaccine in a year. I think it's not just the HIV field, but the whole vaccine field was really primed to make quick advantage of known approaches to develop COVID vaccines. So I think researchers can make a difference in the world. I would suggest that for a lot of people considering research field, whether you're a graduate students don't train for a job at the end of it. There's a big black box at the end of your training. Clinician trainees, their clinical path is very clear, but if they want to do research, that's a big black box at the end of it. And I think the keys for people is to really, follow your passion. What are you really excited to do? And that's the main thing. I mean, we work hard, and the reason that we work hard is because we enjoy it. We get personal satisfaction out of it. Yes, we want to improve the world, but that can take a long time, especially in the basic sciences area. It can take a long time. We have to enjoy it. So, make sure that you pick an area that you really enjoy, you love coming to work and you love working on the project. And I think that passion will be really important. And the final thing, and whether you're a graduate student or you're a department head or you're the head of a national funding agency, the one thing to emphasize is that it's important to get involved in leadership as soon as possible. So even as a graduate student, in your graduate program, you'll get out of your program whatever you put into it. So the more effort you put into meeting people, going to organizing sessions, attending sessions, the more that you are engaged in that, the more you'll get out of it. Likewise, if you're a young researcher, if you just stick to your own area and focus on your own particular research, that's fine. But if you can step out a little bit and provide some broader leadership, I think that's a great way to enhance the quality of your life and your academic pursuits and your professional pursuits. And it does provide a really important demonstration in your CV that's important for your career development. Those leadership opportunities, I think, are outstanding. And maybe something that we can come back to. I don't want to take too much time on it, but I think it's taking advantage of serendipity, of chance. We all have never really planned to get where we are, but an opportunity came our way and we took the chance and we said, this is really interesting. I think I could do that. I'm going to follow this chance opportunity. And I think sometimes that, the chance opportunity or the road less traveled is really the most worthwhile one. So I'll stop there.
Good. Thanks, Keith. So I'm sure there's people in the attendees who want to conduct research more of a community, in the community. And Terry and Alexandra have made a career in that. So maybe both of you can share some advice as far as how to do it successfully and how to do it in the right way. Why don't Terry, you can start, and then Alexandra will go after you.
Okay, thanks, Curtis. Yeah, and actually, I noticed in the comments, Anonymous has posted as well about, do you need a PhD? And I do want to say that I don't have a PhD. I never had any interest in actually getting one to conduct research. So it is possible for people from the community. It sort of leads into the reason why I started doing this research. Since 2008, my first job was actually as a community community-based research facilitator. It was a program funded through CIHR, and there were 5 of us in the different regions across Canada at any given time. And that job was mostly about building relationships or brokering relationships between community groups, which I was a part of, and academic researchers, and trying to explore ways. This is in the early days of the community-based research funding stream with CIHR, but it was to explore ways that academic researchers could involve community in their projects. And so that was a big part of my job, which led into discovering and working directly with a lot of community people that had an interest in research, but didn't have a PhD or didn't have the qualifications, and wanted to know how to get involved in this kind of work because it was their community, it affected them directly, and they were tired of seeing research that didn't really benefit community people. So looking at what the benefits are for community itself as a whole population health scope, and also individually as community people that want to be involved in research, it's there's a lot of opportunities there. It just really takes a bit of capacity building, skills building, exploring things that they might be good at. For example, for now, I actually have a lot of people that work in community-based research projects, and some of them are even interested in things like statistics or the knowledge translation phase of community projects. So a lot of times people get pigeonholed into just doing surveys or interviews as community members, and academic researchers often don't think about the other areas where people could be involved and very meaningfully. So I look for those opportunities and try and broker relationships with academic researchers and sort of give them opportunities for people to meet with them and say, okay, here's what I'd like to do. This is the sort of thing that interests me. This is my background. Can we make this fit? And I think there are a lot of opportunities. One of the things that I encounter most is that people just don't really understand where they could fit community into the project that they're working on. And some of the alumni from this very program, the new researchers, have contacted me over the years that I've done this, and have actually included community people where they wouldn't normally have done so in very, very quantitative studies that wouldn't normally involve community people at all, but they were paired up with community people that had that kind of aptitude. So I'll leave it there and turn it over to Alexandra.
Thanks, Terry. So in terms of community-based research, I think that some of the things that we have been doing, and in particular, it's been in the last year and a half, 2 years, have been really quite innovative and truly community engaged, but also looking at how we can be leveling the playing field so that our community partners are able to participate in research in a very different way. We've been doing a couple of different approaches over the last little while, and watching and evaluating to see how this is working. But I think that one thing that I would like to mention is people have mentioned serendipity a few times, and I think that's really critically important. But I think also you have to be prepared to go after things and really put yourself out and take the other side, the other position, and see what it would be like to be working in that environment and really trying to understand things. So as an example, I really am focused on Indigenous health and wellness research. And when I first started down this path, I think I was doing a lot what many other researchers are doing, which is applying a Western frame and lens and methodology. And it took a while to for me to really begin to understand the entirely different epistemology, axiology, ontology that Indigenous people come to understand life in the world and how we're approaching research. And so at this point now, I recognize that it's not just methodologies, but an entirely different approach, a different way of understanding things, different ethics, different processes. And part of the thing that I find very exciting is that among my research partners are in fact Indigenous elders and knowledge holders. And so we're dealing with a very different kind of research at this point. So I think that where and how people come to understand things can be very exciting, and you just have to be prepared to, I guess, walk that path. So
Great, thanks for those words from both of you. I am trying to keep track of the questions and realize that we're now falling horribly behind in trying to address all of them. There were a couple, well, there was multiple ones about the work professional life balance. I'll just have say a couple of words, and then I'll ask anybody on the panel to add on to that. For me, I've always tried to schedule my family activity with the same rigor that I would schedule my appointments or my blocks of time to write papers or write grants. And in that way, I'm not allowing my family to always come up as the runner-up in any competition for my time. And I also have always used an acid test. And my kids are older now. They're all in their late teens, early 20s. But if I would come home and nobody was excited when I walked through the door, there was sort of an indifference, that would be an indicator to me that I've got the ratio wrong. And also made some decisions about where I lived in proximity to my work. And also making sure that I always made time in the evenings for the family above anything else. And so I guess it's worked out. You also, the other bit, and then I'll stop talking, is you can't do everything. So don't beat yourself up constantly for the things that you're not doing. Give yourself some credit and congratulations for the good things that you're doing with your family, with your academic life, and also always make sure you make some room for your own personal activities. So whether you paint, do athletics, whatever, make sure you do some time, reserve some time for that as well. You don't want to abandon all your interests and everything else in your unbridled march for academic perfection. Okay. Who wants to go next? Marissa, we haven't heard from you in a while.
So I fully agree with everything Curtis has said. I think that I wish I did it as well as how you sound like you're doing it, Curtis. It's tough. You have to really work at it. I'll be fully honest with that. I've got youngish kids, so I've got twin boys who are 10 years old, and I have to work to make sure that I am being present with them, and so. I'm not maybe as sort of systematic or rigorous as Curtis in terms of setting aside or defining those periods of time. But I do make sure that it happens, and it is an absolute priority to do so. I've been fortunate in that one of the ways I've approached it is because I work in global health, and I am often on the move. When my kids were younger, actually pre-starting into school, and even during school now, we would often, pick up as a family and go to wherever we needed to go, to where my research took me. So we would be together, and my research team members will tell you that they've all had the chance to either, live with my family wherever we are, or work with my family, or meet with my family. So family sort of becomes weaved into things as as I've gone through my path. And now I am in Delhi, as you heard earlier, and I'm here with my family now. I still have to figure out the work-life balance here as well, because, you know, they're in school and I'm at work and still having to travel for what I'm doing here. But you do just have to make concerted effort to make sure that you've got time for yourself, as Curtis was saying, for your family. Work is amazing, and I think we all really love what we do, and we do feel lucky to do what we do, and we work hard at it. I know everyone here works very hard at what they do, so it's long hours, but you need to take that time, and you got to just keep checking in with yourself and making sure that you figure out whatever works for you and your family and your situation to do it.
Yeah, your comment about keep checking in on yourself, I think that's really important. Sometimes I'll catch myself when I'm walking through life like a big bear, sort of like a little bit too much, anger. So, if you notice that in yourself, then it's time to sit down and say, okay, I got to change this and I got to change that, to sort of make sure that your happiness quotient is where it needs to be. So. Keith?
Just everyone on the panel has lots of insights into the work-life balance. So I'll just be quick with a couple of things. I don't think that you can absolutely have a perfect balance all the time. Sometimes your family needs to come first. Sometimes your work needs to come first. But I think it's being open about with people at work that no, I'm not available. I'm with my family. That's, sorry, I can't. Over this weekend, I'm protected. I'm doing my family thing. And with your family, sorry, I have something that's really important. I got to work really hard for the next few weeks. That's my advice. I failed, absolutely failed. And the reason that I recognize this is my young son at the time, he's 21 now, but when he was 7, we were talking at home one time, and we were talking, and in the context, I said something, and he said, I hate that word. And I said, what word? Research. I hate that word. And I said, why? He says, because you're either never around or when you are, you're grumpy. So I failed in my work-life balance because my son affiliated or associated the word research with negative things. And so I tried to do more to celebrate with the family, the work achievements. So if you get a paper published or if you get a grant or something, take the family out and celebrate with them, because they're an important contributor to your success, whether they're contributing directly or whether they're just supporting you emotionally. They're part of your success. So have your family celebrate with you and protect time for them. I absolutely agree.
Good, thanks. One of our participants has brought up a really important point here, and say, let's be honest, there's limited opportunities in the academic venue. Which is absolutely true. So I think the first comment I'll make before I turn it over, and I think I'm going to ask Terry to comment on this first, is go into academia if that's what's really stoking your fires. There are many different directions that your research can take you and your career can go. And don't just sort of go into academia because, well, I guess it's sort of the expectation. You gotta, it sounds cliche, but you gotta go with what you're really stoked by. And it's, I think with anything you do, it's going to be hard. There's going to be setbacks. So it needs to be worth it. So if when you're doing this self-reflection, if you say, okay, I don't know if this is really worth it, then try to step back and take a path that maybe will get you to some other area. So Terry, maybe you want to comment a little bit, and then I'll ask Shirou to comment on other directions that your research career can take you, because academia is not the only place where you can make a difference.
Yeah, thanks, Curtis. I totally agree. And as I said before, I don't have a PhD. That was actually a conscious decision. I could have pursued that avenue, but chose not to. I've actually held research grants myself since the very early days of the CBR CHR stream. Since 2005, I think, was the first grant that I held. And now they wised up to me not having a PhD after the first time they gave me a grant and error. And then I had to use or partner with someone with a PhD and be the co-principal investigator, or now it's the principal knowledge user on a grant. So that's definitely a possibility. And I think that for me, I didn't really have a desire to get into formal teaching as in a university setting. I really did want to work more with community and develop not only community research, but the community researchers themselves and their skills around doing that research for and on and with our community. So there's lots of opportunities to do that in non-conventional ways. I worked through a community agency. Now I have my own research consulting firm. But when I worked in a community agency or a community-based organization, it was a little more difficult because you often had to do research off the side of your desk because your predominant role is one of doing programming. And most community people that get involved in research, their desire to do that, and mine included, is really about giving back to the community that we're part of and not just gaining knowledge for the sake of learning things. It's really about applying that knowledge. So I would encourage people that you can do that within any research project, really, but by developing a relationship with community, you can find out how that can benefit the community itself, which is incredibly important. And that is the reason why community-based organizations would partner with an academic researcher to do that kind of work, is that what's in it for us. So always consider what is in it for the community people themselves, and how can they be involved in order to better the situation and look at a research question. The first project that I actually held a grant for was one that did develop very organically through the community work that I was doing, and I had questions. And so I developed the research question with a PhD, and then we got it funded, and it took off from there. It lasted 3 years. So it can be done that way. It doesn't necessarily have to be a top-down approach. It can be from the community up. And I encourage people to look for opportunities and ways to do that within any kind of work that you're doing.
So Shirou, do you want to talk about the non-academic career opportunities that are out there for many of our participants?
Yeah, so when I was before I was doing the CIHR job, I actually my research lab is located in an immunology research center where we have about 14 laboratories, and at any given time we have about probably about 40 to 50 undergrad students and another 30 to 40 postdocs that are, trainees at that point. And this issue is not new. I mean, 8-9 years ago, this was a big issue that we heard very frequently that, what are the options and what are the career paths? And without a doubt, what you're seeing here is a very narrow lens on people who have chosen academic careers. We know that majority of people who go into graduate school, whether they do a master's or PhD, do not end up in academic careers. But the question is, where do they end up? And I can tell you that regardless of what they do, your science training really stands to good use in whichever field that you use. So just to personalize that, probably in the last 23 years that I've run an independent lab, I've probably had 40, 45, trainees at different levels, postdocs, graduate students at different levels. Where have they ended up? A lot of them want to go into medical school to become doctors, right? So great for them if that's your choice and that works out. But then, go down from that list. A large number of them go to industry, different levels, where you can work in an industry, pharmaceutical industry. And then from there, it just expands. I have PhD students who are actually in charge of running big clinical trials. They're running laboratories, they're running microbiology labs in different places, government jobs, right? So my taking this position at CIHR, I've actually hired back some of my students who left like 5 and 6 years ago, thinking of their skill sets and saying, you would be very appropriate for strategic thinking. So master's level, PhD level students, Health Canada, Public Health Agency, CIHR, go down the list of government jobs. And then I'm not talking even at the level of, the provincial government jobs. So a lot of those labs, where you can be located. I'm just looking at my list of things that I wrote. So the other thing that I want to flag, a lot of people love teaching. I've had many students who've done PhD and said the best part of what I did was being a TA. So if that's your passion, then there's lots of academic and non-academic routes to follow for teaching jobs that you can do. So there's lots and lots of option. I just tell people that just because there's no specific, a lot of people like going to medical school because once you go to medical school, the rest of your life is set up for you. So maybe you don't have that level of security that, as soon as I'm done medical school and, we can get into nuances, or Curtis or Marissa can talk about that, going to medical school doesn't really ensure that your interests are going to be 100% aligned with what you're going to do for the rest of your life. If you're lucky, if you get the right placement in the residency. But in terms of when you go to graduate school, you're getting excellent training for analytical thinking. If you're getting a PhD, I remind people that PhD is a degree in thinking. It's, you may be a PhD in immunology or infectious disease, but at the end of the day, what you're trained to do is to think strategically, think analytically. So where can you use that? I have colleagues who've actually gone into finance areas, patent lawyers. So those are all different career options that are there. And I completely agree that, academic positions are for a minority of people who have a certain knack of being able to do certain things and like to do things a certain way. So I wouldn't say that you should limit yourself to say, I don't know what to do after graduate school. Look around you, talk to people. In my center, we organized all kinds of talks to have people who are doing different things in their career. So ask, your department to say, can you organize a series of seminars where you can bring back people who are doing non-academic jobs so we have a better idea of what they're doing. So hopefully that gives people some ideas.
Good. No, that was nice. Thanks. Yeah. So, as far as does having an MD set you up for life? It doesn't. Again, it gets back to the comment that many of us have made already: is make sure that's what you want to do. Don't go into medicine just because it seems like the thing that people do. Because I've encountered many people with an MD after their name that aren't very happy doing that. So and that leads into another couple questions. Should I do this training? Should I do a PhD? Should I do an MD? If you're really driven and stoked to do it, then by all means get additional training in whatever area you have an interest in and that you think you can make a difference in, and that you think, in a strategic way of looking, that you think is going to make you more employable to do the things that you love. So having unique skill sets in many different areas can really only help as far as opportunities down the road. Marissa, we didn't talk much about public health, and that there was a question from a basic scientist. I like basic science, but I'm also interested in public health. How would you advise somebody in a different discipline to bring those talents into the public health venue?
So, the research that I do is always team-based, and it's that way for a number of reasons. So one, I like working with really nice and really good, smart, kind people. But I think by coming together as a team, you bring a collective strength. And so I don't have a PhD. I recognize the strengths that I bring to a team, but I also recognize the areas where I need to have other people come. And I think by working in a team of people, it allows a couple of different things. You can bring people who have those complementary skill sets or strengths, but it also allows you to work with people who have different lenses. So you might, I in the teams that I work, will often be working with anthropologists or other social scientists. We work with basic scientists. We work with mathematical modelers, and you're all working together in public health to address a complex public health issue or challenge. So I think if there's, that interest to sort of answer complex public health questions or to try to understand what the population level outcomes might be in terms of whatever question you're looking at, you can contribute, whether you're coming from basic science or social science or clinical science or epidemiology. There's that need to really be looking at these big questions or these wicked problems from many different lenses. So certainly I think it's finding people, whether they're in your department or in other departments, that have sort of shared or common interests, and coming together, finding those networks so that you can work together to answer those questions, and spending time with each other to really understand, what it is that you do and what it is that you're wanting to try to solve for. And I think, at the University of Manitoba in Department of Community Health Sciences, I'm cross-appointed to the Department of Medical Microbiology and Infectious Diseases. So we're always bringing people from different departments together to try to work to answer big public health questions.
Good. Thanks, Marissa. So we have about 9 minutes left in this session. I'm sure we could go on forever. I think we've addressed most of the questions. I apologize if we haven't got into the level of granularity that you're hoping for. But I was thinking we could spend the last couple of minutes together where if the panelists could identify one pearl that hasn't been discussed yet that you'd like to spend a minute just discussing. And how about we'll start with Keith, because I like to keep him on his toes.
Yeah, I think the main thing for people to think about is that so in my department we have 60 to 70 graduate students. All of them go on to do research or to have sorry, not research, but to have engaging careers. There's a couple that are not doing research or anything related to their master's degree, but the vast majority, and this would be hundreds, have all gone on to do a whole wide range of different careers. And Shirou mentioned many different possibilities. I think you just need to put in the effort to attend career development workshops. You're obviously attending this one, so that's a good sign. But your university likely puts in lots of different workshops, and just to try to find out what opportunities are out there, and to ask questions. If you find someone who is doing something really cool and you'd like to emulate that career path, then reach out to them and ask them for their advice. I think the more that you're actively engaged in finding out what careers are out there, the better it'll turn out for you.
Great, thanks, Keith. Terry.
Well, as far as careers go, I'm not expecting that anybody in this workshop will probably want to entertain a career as a community person. But what I would encourage you all to do is to think of ways that you can include community in the work that you're doing, because it will make it very interesting. It's one of the most common things that we find with involving community in your work is that the information becomes very rich and full of nuance that you wouldn't maybe have gotten in any other way. So I would encourage people to do that, and maybe to temper some of the academic pressure with thinking of ways that you can do things that would actually benefit community as well as it would benefit academia. Those are like that balance again. The balance question and work-life balance for community members is quite different in that we often encounter challenges around what it's like to be a member of a community or a person living with HIV, and then also being a research subject or working on a project. And then finding the balance between those two things is often quite challenging. So I think the same applies for people starting out in this kind of work. Think outside the box. Don't contain yourself too greatly in that you have to go and do work that you think conventionally is the way that it's been done before. A lot of the best work that I've been a partner on has been where people, as Marissa was saying, developed a relationship on a team and listened to all the things that other people thought that they could contribute to a project. If you're open to that, I think the possibilities are endless and huge. So I would encourage people to do that.
Great, thanks, Terry. Dr. King.
I was hoping I wouldn't be the last one because I'm thinking, ooh, finding a pearl that hasn't already been shared will be tough. I keep on thinking about, in my case, I work with the Indigenous community, but also have done a variety of partnerships with other communities. And we talk about priority populations and the need to really be working with key populations and coming up with solutions that work within that particular environment. And I think that finding a community that is one that you can be passionate about and really a strong ally working with and so on is an incredibly important undertaking and may give you a different path altogether than somebody who is staying within the academy. And so I think that would be one of the pearls that I would suggest.
Great, thanks. Marissa.
So I think that, and this was raised earlier about you will have opportunities that come up, and I think you need to be open to opportunities and you have to be willing to take chances. I think about some of the early opportunities that I was given and the decisions that I made, and often they're kind of leaps that you end up taking, but you take them because it's something that really is of interest to you or speaking to you. And I think you can take them when you've got people around you that are your support network, and they might be colleagues, they might be friends, they might be family members, but they enable you and I think facilitate that willingness to take chances. And it's okay to fail and make mistakes. We all have, and we all do, and we all continue to. But I think it's being sort of open to being able to sort of fumble through things and to ask for help or support when you need it. And I think really importantly is being able to listen and learn from the people around you. And you have to set aside your own assumptions and be willing to question your assumptions so that you can learn and that you can listen. And I think that everybody has talked about that today, about sort of that openness and those supports that are required. But I think that being patient through the process, being aware of where you stand and where you come from is really important. And, little steps, baby steps at a time. And it's remarkable what opportunities will come your way.
Well, that was about 15 pearls. You've totally taken them all from the rest of us. Thanks a lot, Marissa.
Pleasure.
Shirou, you're up next.
So, yeah, I'll be very brief looking at the time. So I guess my pearl would be to, don't let others tell you what you want to do. Chart your own path. There's nothing, you're unique. Your life is unique. Your expectations of yourself are unique. So what works for somebody else may not work for you. So, by all means, look at others to see how is this person doing this so well and how is that person doing this so well, and then chart your own path. And the only thing that I can say is that, manage your expectations. You can't be, a president of a university if you're doing not taking the plan and not making the steps to be the president of a university. So if, being a clinical coordinator or being, a government employee and doing your work well makes you happy, then that's yours. Then, do what it takes to get there. And don't let others tell you. So I'm seeing a lot of comments about pressure to do PhD, pressure to do this. So, reflect on what is it that you want to do in life. If everything worked out well, what would you see yourself be doing? And that's hard, but you can break it down to next 5 years. And your plan may be for next 5 years, I'm just going to explore research and see where it takes me. And that's fine. So I would just say that by all means, look around, but then figure your own chart and chart your own path because you're unique.
I will wrap up this session, which I hope you've all enjoyed. First pearl is surround yourselves by very interesting people. It'll make the journey a lot more enjoyable. And I think we've accomplished that with the last hour. And always remember to say thank you to the people that help you out along the way. It's a nice thing to do, and it'll come back tenfold to you. So thank you to the panelists for participating, and thank you to the participants for your engagement as well. We now have a 10-minute break, so everybody come back at 12:35 when we'll have the pleasure of hearing from Dr. Carol Strike about how to publish.